Next, so now after we discuss the maxillary major connectors, now we'll discuss about the mandibular major connectors. So the way in which the maxillary connectors or the major connectors were used in fabricating your maxillary cast partial denture, similarly your mandibular major connectors will be used to fabricate your mandibular cast partial dentures. So now when we compare just by observing between the maxillary major connector and the mandibular major connector, the function remains the same, that is they connect one side of the components with the other side of the component. So it forms a connecting link between the components on both the side of the arch or the cast partial denture. But when we see the size, they are not as much as big or huge as the maxillary major connector, because the palatal area plays a major role. When we talk about the mandibular major connector, we need to keep in mind that we provide sufficient relief for the tongue and the tissues which are present in and around the teeth, right? So that is very much important. So the design considerations basic which we need to keep in mind is that, first thing, if I talk about the design considerations of mandibular major connector, right? Design considerations. Okay, we discussed the design considerations for maxilla also. So similarly for mandibular major connectors we'll have some design considerations. First, that is adequate relief for tongue should be there. Why, right? Otherwise it might cause discomfort while speaking and might also cause irritation to the patient. So first requirement is that adequate relief for the tongue. Second is they are longer and narrower than the palatal connectors. Okay, so I told that they are longer. Why? Because they run from one side of the arch to other side, right? They cannot bypass the arch as in maxillary connectors, as it was crossing through the palate. Over here we cannot cross from one side to another side directly. We have tongue in between, right? So it has to go all around the mandible and come on the other side. So that is why they are longer and they are narrower, right? Whereas the palatal major connectors or the maxillary major connectors are shorter and broader. These are longer and narrower. Okay, and you need to provide relief in certain areas. Okay, now that relief will be dependent on various factors, right? So first is what type of major connector you are using. So the type of major connector plays an important role when we are talking about the relief part. Second is the amount of slope that is in the tissue lingual to the anterior teeth. So if you see the diagram 1 and 2 on the left side of your screen, that is diagram A and diagram B. If you see the slopes, the lingual slope, this is more shallower and this is more steeper. So if the slope is more shallower and it's going towards the tongue, you need to provide sufficient amount of relief from the tissues as well as from the lower border of the lingual sulcus, so that there is not interference below the tongue, or below the connector or above the connector, right? But if it is steeper enough, a minimum amount of clearance is also sufficient. So lingual slope will also dictate the amount of relief given, right? So if the slope is more shallower, right, then there should be increased relief given. Okay, but if the slope is vertical or more steeper, in that case a minimum relief is also enough. Minimum amount of relief is sufficient, right? Now how do you decide the depth of this slope, right? So you can either use a periodontal probe, okay, which has marking. So you can go with a periodontal probe to measure the depth of the lingual sulcus, or the second option what you can do is you can go on with taking an impression using your green stick and then final impression, okay, as we do for CD. Like that same way we take impressions for our RPD also, and then pour a cast and then measure in the cast also. Okay, so that also can be done. Measurement on casts can be conducted. So few design considerations. First, good relief from the tongue. They are longer and narrower. Type of relief is dependent upon the type of amount of relief is dependent upon the type of major connector, which we will see consecutively, and based on the lingual slope. How will you measure the lingual slope? Using a periodontal probe, or you take an impression, pour the cast and then measure. One more consideration is the margins of major connector should be 3 millimeters away from the gingival margin and 6 millimeters for maxillary major connector. Why 3 millimeters? Because we already have less amount of space, so 3 millimeters is sufficient, okay, but it is essential, so don't forget this consideration also. Now moving on to our very first type of major connector. Okay, so first type of major connector is our lingual bar major connector. Okay, so now again we'll go by the names what it is saying. Lingual bar, so it is a small bar on the lingual surfaces of the teeth. In simple terms, if I say, okay, if you see in cross section, it is half pear shaped. Okay, so if you see from side views, it is a half pear shaped type of major connector. I'll zoom in this diagram for better visibility. See, it is a pear shaped but a half pear shaped. The broader portion remains below and the narrower comes on the upper area, right? It is made up of a 6 gauge thickness. Okay, wax pattern, the thickness of the wax pattern is 6 gauge, 6 gauge, sorry, thickness. Okay, 3 millimeters away from gingival margin, right? So 3 mm of clearance should be there for the gingival margin, and total 5 mm from the lingual sulcus. Okay, so 3 mm from gingival margin, 5 millimeters from sulcus or vestibule, correct? Apart from that, your total length of this cross section, if you see, it should be 5 millimeters. So 5 millimeters is your major connector ka height, plus 3 millimeters from your gingival margin, and plus 5 millimeters from lower border of the sulcus. So 5 plus 5, 10 plus 3 is equals to 13 millimeters. You ideally need 13 millimeters of space. How is that 13 millimeters of space coming? So if you count over here, see, 3 millimeters from your gingival margin, minimum of 5 millimeters from your sulcus, and 5 millimeters of your height, so total 13 millimeters. So this much you need to measure and check whether you can accommodate these type of major connector in that amount of lingual slope or not, right? That is very much important. But if you don't have sufficient space, we'll have to modify the design or go with another type of major connector. Moreover, your main aim should be the bar should be positioned. How is it should be positioned? It should be positioned as inferior as possible. So when you place it as inferior as possible, you do what? You avoid interference from the tongue, right? So it becomes easy for the patient for all the tongue movements while speaking and all the functional activities, right? So if I talk about the advantages of this major connector, so first is easy to fabricate. Easy to fabricate. See, whenever you feel the design is simple, there is not much complexity, you can add this advantage to any type of major connector until unless the design is not so complex that it can be fabricated easily. Okay, then it has mild contact with the oral tissues and no contact with the teeth, so good oral hygiene is maintained. Okay, good oral hygiene is maintained because there is mild contact with the tissues and not with the teeth. When I talk about the disadvantages, so for disadvantages, it cannot be used when there is tori, right? If there is mandibular lingual tori, that bar cannot go continuously from one side to another, right? So tori is one contra indication. Second contraindication will be limited vestibular depth. Limited vestibular depth. Okay, so tori and limited vestibular depth will be the contraindication. Once again, we'll go through the first one. Lingual bar cross section is half pear shaped with a thickness of 6 gauge. Okay, 3 mm away from gingival margin, 5 mm minimum from the sulcus, and total 5 mm of length. Total requirement 13 millimeters. Bar can be positioned as inferior as possible so that you avoid interference from the tongue. If I see the advantages, it is easy to fabricate and helps in maintaining good oral hygiene. Disadvantages, you cannot use it when we have a lingual tori or a very less amount of vestibular depth or lingual sulcular depth, right? So now